Hello, welcome to Avenu Health Group. This is Dr. Veni. Today we are going to talk about cervical cancer and in particular HPV testing. I'm here with my friend Jen, who has done millions of HPV tests, and she's going to tell us about her experience and tell you why you should do HPV tests. Jen, welcome. Good to see you.
Thank you. Hello everyone. Glad to be here. I'm Jen Francis Naluvega. I am a midwife and a counselor. I'm glad to be part of this.
Yeah, thank you, Jen. Jen is an expert at this, like I mentioned. So in case you have any questions about cervical cancer, about HPV, just keep those questions rolling. She is the expert. Yeah, so before we go into HPV testing, I think let's talk a little bit about the cervix, because we could be talking to people who don't even know where the cervix is. They could think it's on the head, it's in the feet. So let's talk a little bit about the cervix. So Jen, could you just explain in simple terms? Please don't use your complicated medical terms. Just explain to people what a cervix is, where it is.
Thank you so much, Dr. Veni, for this opportunity. I'm so glad to be sharing this information with the community out there. Cervical cancer is one of the most common cancers in Africa, and actually it is really disturbing our community as well. I will be as simple as possible as in explaining what cervical cancer is. Cervical cancer is a cancer that affects women. And why women? Because we have the cervix with us. And it's a cancer which affects the lower part of the uterus. So we are here to prevent cervical cancer because it's one of the killer diseases we are battling with here in Uganda, in sub-Saharan Africa, and yet it is very preventable. If we do the right thing, we can really prevent cervical cancer.
Yeah, Jen, just to pick up on that, actually, if you went to most of the developed countries, hardly any woman suffers from cervical cancer. And really it's because they've done what we're asking people to do. They have for a long time done vaccination. They have done HPV tests for a very long time. So it's these things we can do. There is no reason why the Uganda Cancer Institute should be full of women who have cervical cancer. And yet, as we're going to see, it's very preventable. And there are a number of tests we can do to profile our risks for cervical cancer.
And actually what really hurts most in this situation, most of people come to hospitals because of the pain.
Yeah.
And by the time you start getting the signs and symptoms, it's already advanced disease.
Yeah.
So if people could be vigilant and they follow instructions,
yeah,
people would not die from this dangerous disease,
yeah,
because it's really preventable.
Yeah, correct. Please do not, the signs and symptoms, like she's already mentioned about the bleeding, the pain when having sex, and some of those, but don't wait for those symptoms, please. Come for early screening, because like she's mentioned, by the time you come, it's usually a bit late. And maybe just talk a little bit about the risks. You've already mentioned
the signs and symptoms. I think we need
to elaborate more. Okay, yeah.
Because we hadn't talked about them, and somebody could be out there asking, what are the signs and symptoms for this disease? We shouldn't wait for that, not at all.
Yeah.
But some of the signs include, but not limited to what I'm going to mention, bleeding in between periods. So if you have your periods, like after 1 week you bleed again, that is not good. After sex and you start getting a bloody discharge, it is not nice at all. I'm sure for people who are sexually active, you know the normal discharge that you should get after intercourse. But if you get a bleeding discharge, no, go to the hospital as fast as you can.
Yeah, correct. Yeah, and of course, pain when you're having sex could be another, but of course there are so many other reasons for that, but it could also mean that you have cervical cancer. So please, like we mentioned, do not wait for that. So Jen, in your experience, what are some of those risk factors? Of course, in addition to being a woman, so all of us women are at risk because we have a cervix, you already mentioned that. But what are some of those other factors that increase our risk as women?
Actually, I would also, before I go to that, I would like to mention that cervical cancer is caused by a human papillomavirus. And some of the risk factors, the factors which really exposes you to this disease include having more than one sexual partner, starting sex early, and by the way, Dr. Betty, research was done, and girls are starting sex as early as 8 years.
Wow, you can imagine.
And innocently, they don't know that they are really exposing themselves to this very dangerous disease. So
people only remember, think about HIV and one, but all these other risks with starting sex early and early sexual debut. So,
yes, and actually, if you also have HIV, this also predisposes you to that. Why HIV? Because this one lowers your immunity, and this human papillomavirus infection, if you have it, sometimes if you don't have a strong immunity, your body will not be able to fight it off. So when it persistently stays there, that virus, the human papillomavirus stays on the cervix, it can progress into cancer.
yeah, thank you. And Jen, that's another important point. Our bodies ordinarily can't fight human papillomavirus, but when you have some conditions that lower your immunity or your body's ability to fight disease, sometimes some of these infections like the HPV or human papillomavirus persist, therefore end up causing the cancer we're worried about. Okay, very, very interesting. So maybe just to give a brief of all the preventative methods out there that we can, things that we can do to prevent cervical cancer. Jen, could you just kindly just give an overview? Because we are going to talk about all of these methods subsequently, but maybe just an overview.
Actually, there are 3 stages, like 3 ways on how to prevent cervical cancer in the community. We have the primary prevention, secondary, and tertiary. But basically, if we could do the primary and secondary prevention, it could really do a lot of good effect and prevention on cervical cancer. For primary prevention, we have immunization or vaccination of young girls, and this is something which the government has taken on from the age of 9 to 14 years.
Yeah, mothers, please do not hide those girls. They are looking for them everywhere. They are vaccinating them from school. Please do not hide the girls. If a school approaches you about a vaccination program happening, please do not do your girl some bad by preventing her from getting vaccinated.
And you know, there is a lot of propaganda about vaccines. But honestly, vaccines are good for us.
Yeah.
They are really good. And some of people get the herd immunity from the community and they're like, me, I did not vaccinate, but I am very fine. But these vaccinations are very good. They are highly recommended. That's why, just like Dr. Benny mentioned, in those well-developed countries, they do not get these diseases. They don't kill their people because they take all the advice, they do the vaccination. So one of the primary preventions would be vaccination of the young girls between the age of 9 and 14 years. But still, if you are a virgin when you are 30 years and you are not sexually active, that means you're a virgin. You can get the vaccine.
Yeah.
You can get it for yourself. The government is not including even the boys because we cannot afford. But even the boys could be vaccinated.
Yeah.
And in addition to that, the male child can be circumcised.
Yeah.
Can also.
Ladies, take your men for vaccination. And men, when they approach you to vaccinate, please listen. Okay? Yeah, so thank you for that. And then, of course, we have the secondary prevention, yes. Yeah.
For the secondary prevention, this is where we want women to go for screening.
Yeah.
And because you know that what takes people to the hospital is pain. And because they are not feeling any pain, they don't go for the screening. Honestly, dear ladies, if you are above 20 years, 25 years, you know, and you are sexually active, you screen routinely.
Yeah.
If you're HIV positive, you do it every year. If you're HIV negative, you do this after 3 years. This will really help us really eliminate. There's so many cases at Cancer Institute. It's really full of women with cervical cancer, and yet if we screen regularly as recommended, we could prevent further suffering.
Yeah, and HPV screening or HPV testing is the main topic of this episode. We are going to go a little bit into that in a bit, but before that, maybe just to mention, there is what they call tertiary prevention, but that's really treating people who already have cancer, and we are not getting there, so we won't even talk a lot about that.
Okay, they have the precancerous lesions and the cancerous lesions. We don't want lesions, we don't want to go into that tertiary prevention.
Yeah, perfect. So, HPV, like we mentioned, over 90% of cervical cancer is caused by HPV, and it's mostly type 16 and type 18. There are so many types, over 30 types, but those two are the most important. And the tests target those two because they cause the most cancer. And the test specifically looks for the DNA of HPV in the cells that are taken from your cervix. So it's a DNA test or a PCR test. So during COVID, I think we all heard about PCR and so on and so forth, COVID PCR. So this is also similar, except at this time, instead of looking for the COVID PCR, we look for the PCR of the human papillomavirus or HPV. Yeah. So now we're going to talk a little bit about how to prepare for the test, because I'm sure by now we have convinced everyone who's listening that this is the way to go, we have to test. So Jane, if I've made that decision to start HPV testing, what can I do to prepare ahead of that test?
Thank you so much, Dr. Benny, for that. If you want to test for cervical cancer, I'm sure I hope you have watched our previous series whereby we said that today, like currently, we are doing the testing towards HPV or the pap smear. That is what we have currently in Uganda. So if you want to test now using the HPV test, here we shall be looking at the DNA of the human papillomavirus in your private parts. And this virus can easily be picked from the cervix, the vaginal wall, and then the vulva. It can be anywhere because we actually, as you have seen, have also said that this virus can also be dormant, hidden in the prepuce of the male child if they are not circumcised. So if you want to prepare for an HPV test, you are advised to abstain from sex at least 2 days prior to that test. And
what if I don't want to abstain?
You can use a condom.
Okay.
You can use a condom, but 2 days only will not kill you.
Okay, if you say so.
Yes. And also, if you are in periods, you can also do HPV test because the DNA will really be positive if you really have the HPV infection with you. But to avoid that messy part of it is messy. Remember, ladies, second day you are bleeding so much and all that. So for compatibility purposes, you would wait for your period
to end. That's what I usually do. You wait and
to avoid the messiness of the whole thing. So you prepare yourself like that. Psychologically, you prepare yourself because basically we are going to tell you how the procedure is done. Sometimes, when you don't have pain in that place, it's very hard to open your legs and say,
check.
And actually, if you also want to be comfortable, you shave. You shave because
you must shave, surely. You should shave.
Shave because you might feel uncomfortable.
Yeah.
I would like to share an experience.
No, not today.
Okay. All right. So you will be clean, you'll be ready mentally, because they will ask you to remove your part and all that. So you prepare yourself.
Yes, and wear your best underwear. I don't want you to remember. You may come to the hospital for testing, or we might come to you at home for testing. Then you remember, and then you change your mind about the test because of underwear.
Yes.
So also prepare your best underwear for that day. Yeah, so anyway, you forgot one important thing as part of the test, of the preparation. you have to call the Venue healthcare team and make your appointment.
Yeah.
You know, I'm joking. You can call whoever you're comfortable doing that test and prepare and make sure that they are ready to have you when you're ready to go.
Yeah.
Okay. Now, the actual procedure. So you have come, Venue has come home or wherever I am to test, or you, or I have, one of our viewers has come to your hospital for testing.
Yeah.
What should they expect? Because I realize that a lot of us do not come for this test because we think, oh my God, maybe it involves injecting me and things like that. So I think let's go through the procedure so that people know. People who fear injections could be just fearing the test for that. Yeah. So if I come, what are those steps when I come to you for the test?
Okay, for the HPV testing, there is also that possibility of doing self-testing. And then there is also the possibility of the healthcare worker to take off the sample for you.
Yeah.
So I will start with that one of self-testing. With self-testing, they will give you instructions on how to collect the sample from yourself. Then you will go with the sample to a private area where they will instruct you to remove a panty.
Oh, you will remove it because now
Plastic or metallic.
it's not an injection. It's not an injection.
So it helps to throw away the vaginal wall so that you can easily see the cervix.
Yeah.
You cannot see, the vagina is like this. So when they insert the speculum, it gives them way through to see the cervix.
Yeah.
Yes. And
Think
the cervix
about-
are opening of the uterus, as we mentioned earlier.
Yeah. So think about the speculum like a tube, a smooth tube that's put, like Jen has mentioned, because when the walls of the vagina close and touch, now they need to put this tube in order to pass through the vagina and go to the cervix. So that's the importance of the speculum. And you're seeing, I'm sure you're going to show it on the screen to be able to see what it looks like. But it's very gentle. Don't let its shape and size scare you. Very, very gentle. Yeah, so they've inserted the speculum. What do they do after?
If they insert a plastic speculum, it is not cold, but the metallic ones are a bit cold. That is the only discomfort you might get. So what you do, you relax as you insert the speculum into the vagina. But if you keep tensed up, it will be painful because they will be using some kind of energy. But you just relax, and then it will be just like an
smooth
insertion of a penis.
No, it can't be like that.
It's gentle, it's not painful at all. Yes.
Like I warned you, Jen is a midwife. Midwives say it as it is, so.
It's gentle, really. Just the coldness might make you
a bit uncomfortable, but yeah, very gentle.
Yeah.
So once they've inserted it, usually they might use a small, soft, gentle brush, or what we call a spatula.
Yes.
And that's what they use to go and make a sweep on your cervix. So they just turn it like to pick cells from the cervix. Please, this is not a blade.
Actually, in a layman's language, like ladies, if you are washing that place and then you just insert your finger into the vagina, there are some, it comes out with some fluids. So they collect that fluid around that place, and there are cells in that fluid, even if you use your finger. So they will use the swab or spatula or a brush to collect those cells.
Yeah.
That fluid will be containing cells, and then we shall be testing for DNA of that human papillomavirus. That's when you're doing the HPV test.
Yeah, thank you. So once they remove that brush with spatula, it will have the cells, like she's mentioned, and they just put them in a tube that has a preservative for the cells, and then it's sent to the lab, and like she has mentioned, it will be examined for the DNA of a HPV test. So when this is done? Okay, by the way, how long does this procedure take? Is it 4 hours, 1 hour? Because I might want to come during my lunchtime break. Someone wants probably to use their lunchtime break to do this test. Is it possible if they call Venue to come and do it home? Do they have to plan for a whole day? Like, how long does this take?
Actually, the only part which takes up a lot of your time is during the preparation, like you're removing your undies, climbing the bed and all that. But the real procedure can take about 5 to 10 minutes.
Yeah, very
you just
short.
Go there, relax on the bed, and the speculum is inserted, and then they get a swab or spatula brush. They collect the cells or the fluids from the cervix, then they put in a tube and then take it for testing, and you get the results in about 1 or 2 weeks.
Yeah.
And you get your results.
Yeah, so very short time. And what happens if I get negative results? What should I do?
When you get negative results for HPV,
Negative in the sense that there is no HPV. Yes.
That means that you don't have the human papillomavirus in your body.
At that time, because it
time.
could change, if you're still having sex, you could get HPV the following day.
Yes.
Yes, so at that time, at the time of the test, yes.
And actually also to remind people, you can get that HPV, the human papillomavirus, the next day, but your body will fight it off. And
Yeah,
then
for the most part, yeah.
Yes, for the most part it will come off. So basically, it's that.
Okay. Yeah, so if it's negative, I think they will advise you on when to do a repeat test. And the duration, the interval between the tests depends on the result from this test and also from which other medical conditions you have.
Exactly.
Yes.
If you're HIV positive, you do it every year. If you are HIV negative, you do these tests every after 3 years.
Okay. Yeah, and the reason we do it more frequently for HIV is because it's another risk factor. It reduces your immunity and it increases your chance of the HPV virus actually causing cancer. So that's the reason why we have more frequent testing for those who are HIV positive.
So basically, when you are HPV negative, just like how Dr. Ben was asking the question, if you are HPV negative, please don't stop at that. Do routine testing as recommended by the Minister of Health.
Yeah.
And also you should know that the HPV test at the laboratory, they will be looking for the DNA of the human papillomavirus. That's what they will be looking for.
Yeah.
That fluid on those cells.
Yeah. So, and then what happens if it's positive? What do I do? Is it the end of the world for the person? The end of the world for me? What do you do? What do you advise they do?
Now, if you have HPV positive results, that's not the end of the world. And actually, that doesn't mean that you have cervical cancer.
Yeah.
Doesn't mean that. However, if the human papillomavirus stays long in that place of yours, like your body has failed to fight it off, you can progress into cancer. So, when you have an HPV result which is positive, we usually do some treatment for you at the moment. We have thermocoagulation and cryotherapy, which you can easily help us to treat that.
Okay.
So, if you have HPV positive results, we give you thermocoagulation or cryotherapy.
Okay. So if you're HPV positive, we'll call you back. If you do it with us or whoever you do it with, they'll call you back and tell you what the next steps are. And also after that treatment, you will get more frequent testing. You'll be testing every year because we need to make sure that the treatment worked and the infection did not persist. I think, yes, please go on.
And I'm thinking that people might be wondering what is thermocoagulation and then cryotherapy.
Let's skip that for the next episode because we are going to talk about the PAP as well, and then we'll talk about these many big words that Jane is now talking about. Yeah. Okay, so I think this has been really useful. I knew a lot about cervical cancer testing and HPV testing, but I've learned a lot more from really speaking with you. No wonder you've looked at 1 million cervixes. Now, maybe just before we close, because many women come to you and say, oh, doctor, but I don't want you to look at me, I'm a little bit shy. I think Jane is going to give you the guarantee that actually all body parts to health workers, they all look the same. So she will not even remember what you look like the minute you walk out of the...
Very true. Whether male health worker or female, they will not remember.
They will not remember.
Yes.
So please don't be shy. Let that not prevent you from coming for testing. And honestly, a little, let's call it version of your privacy for a few minutes, maximum 10 minutes, and getting cervical cancer. I think for me, one is more serious than the other. This discomfort could be foregone, or this loss of privacy, as people call it, could be foregone. So don't be shy. Please come. I think this has been really useful.
Don't wait for the signs and symptoms.
Yes,
Don't
do
wait for
not
that pain.
wait. Don't wait for pain. Please bring your cervix.
And
Let's look at
actually,
it.
Dr. Veni, we don't look at our cervixes.
Yeah.
So you don't know how it looks like. Give
Yeah.
another person a
To
chance
look
to
at-
look at it.
Yeah.
It's just like a ripe mango.
Yeah.
You see it looking very nice, but you don't know what is inside there, and you cannot see your own cervix. So
Yeah.
give us a chance to promote.
These analogies are killing me, Jane, but yes, yes, please get your cervix screened. We have these tests available for you. We can send a midwife to your home, to your workplace, wherever is convenient to screen. Some ladies have done it as a group, they organize themselves. We send someone to actually screen you in the comfort of your home, or in the comfort of wherever you want to have this test done, and the results are sent back. And depending on the results, you'll be given advice. So don't be shy, just call us and we will, send someone to do this test for you. And before we close, do not forget to hit the subscribe button. There are so many episodes about cervical cancer coming up and about other important health topics. So follow us, subscribe to our channel, and keep updated with all of the useful content that we'll continue to share. Thank you, Jane, for this. I think this has been useful. Next episode, we'll be talking about pap smears. People confuse HPV and pap smears, and we'll be talking about that. Thank you, and see you soon.